Hello and welcome to another episode of Beyond the Hospital, where we break down health topics in a way that makes sense to you. No big medical jargons, just real talk about your health and how to take charge of it. Today we're talking about something that affects millions of people worldwide, yet many don't fully understand it. Hepatitis B. Some people hear about it for the first time when they go for a routine checkup, a job medical, or before surgery, and then they panic when their results come back positive. But hold on. Testing positive for hepatitis B does not mean your life is over. So let's break it all down. What it is, what it isn't, and what you can do about it. Now, what is hepatitis B? Hepatitis B is a liver infection caused by the hepatitis B virus, HBV. Think of your liver as a hardworking factory. It processes everything you eat, drink, and also helps to get rid of toxins and stores energy. When this virus attacks the liver, it can cause inflammation, just like how a wound on your skin gets swollen and red. Now, how can you get hepatitis B? Many people hear hepatitis B and assume it's from something dirty or shameful. That is not true. You can get hepatitis B in everyday situations without even realizing it. It spreads through blood and body fluids by sharing sharp objects like razors or unsterilized needles, including in medical settings or tattoo parlors. It can also be transmitted via mother-to-child transmission. A mother with hepatitis B can pass it to her baby during childbirth, which is why screening during pregnancy is super important. You can also have hepatitis B via unprotected sex, like having sex with someone who has hepatitis B can also help in spreading it. It can also be transmitted via close household contact. If someone has an open cut or sore and they share personal items like nail clippers or toothbrushes, and the virus can spread via that route. Now, one big myth I need to bust. You cannot get hepatitis B from casual contact like hugging, sharing food, or shaking hands. So please, don't stigmatize people with hepatitis B. Now, what are the symptoms of hepatitis B? This is where it gets tricky. Most people don't even know they have hepatitis B. Some may feel completely fine, while others may experience fatigue, feeling tired all the time, yellowing of the skin and the eyes in terms of jaundice, or what we call dark urine, just like Coca-Cola. We call it Coca-Cola colored urine. And you can also have nausea, like feeling of vomiting or loss of appetite, and some even vomit. But again, many people don't have any symptoms at all. And the only way to show is through testing. Now, understanding hepatitis B test. If you've ever done a hepatitis B test, you've probably seen something called HBsAg on your report. That stands for hepatitis B surface antigen. If your HBs antigen is positive, it means you have the virus in your body. But wait, before you freak out, this does not mean you have liver damage or that you need treatment right away. If your HBsAg is negative, you do not have an active infection. But that's just one part of the story. To fully understand what is happening, we usually check what we call an hepatitis B full profile. This includes HBc antibody. Now, anti-HBc, which is also known as hepatitis B core antibody, it shows if you've ever had hepatitis B in the past. So this is why even when you have hepatitis B surface antigen, we still request this other test for us to understand the level at which the virus is in your body. Now, we also have HBe antigen, which is also displayed on the hepatitis B full profile. Hepatitis B E antigen, which is the HBe antigen, it helps us understand if the virus is active and multiplying. You also have the HBV DNA, which measures how much of this virus is in your blood. So you tested positive. What's next? This is where a lot of people panic. They hear positive and think their liver is shutting down. That is not true. The reality is many people who test positive for hepatitis B will live normal, healthy lives without needing treatment. Here is why. Some people have inactive hepatitis B, where the virus is present but not causing any damage. Some clear the infection on their own. Some might need monitoring over time to see if the virus is becoming active. We don't just start treatment immediately after one positive test. Instead, we monitor your liver function over several months or even years to decide if treatment is necessary. Now, when do you need treatment? You might want to ask. We will decide on treatment based on the following. Your liver function test. Is the virus damaging your liver? We look at that. Then you look at the viral load, which is the HBV DNA levels, which I spoke about earlier. How much of the virus is in your blood? There's a level we watch. Once it is at that level, then we can start treatment. Then you look at the signs of liver scarring, like fibrosis or cirrhosis. That is if the liver is having scars. If there's already damage, treatment might be needed to slow it down. What most people don't know is that hepatitis B is one of the few viruses that the body can sometimes fight off completely. Some people recover from an acute infection and never have issues again. And even if you have chronic hepatitis B, with proper monitoring and lifestyle changes, you can still live a long and healthy life. The best protection for hepatitis B is what? Prevention. The good news, hepatitis B is preventable. You can get vaccinated. When you do an HBsAg test and it is negative, the hepatitis B vaccine is one of the best ways to protect yourself. It is safe, effective, and lifelong. Then it's also advisable to practice safe sex. You can use protection if you are unsure of your partner's hepatitis B status. Avoid sharing needles like razors or toothbrushes. And it's even advisable for men that you have your own hair clippers when you go to the salon. Simple changes can help make a very big difference. Then we also screen pregnant women. For women who are pregnant, always ensure that you are screened for hepatitis B. That would also be done in any hospital that is worth its salt. If you're pregnant, getting tested can protect your baby from getting infected at birth. If you take away one thing from today's episode, let it be this. Testing positive for hepatitis B is not a death sentence. It is a signal to monitor your health, make good lifestyle choices, and get medical guidance when needed. If you or someone you know has hepatitis B, encourage them to see a doctor for proper evaluation. And if you haven't been tested yet, now is a great time to do it. Knowledge, they say, is power, and early detection can save lives. I hope this episode helped clear up some of the confusion around hepatitis B. If you found it useful, share it with someone who needs to hear it. And don't forget to subscribe to Beyond the Hospital so you never miss an episode. Until next time, stay informed, stay healthy, and remember, you are more than just a diagnosis. Thank you.